Signs and symptoms. Signs and symptoms of cancer vary depending on the type, location, and stage of the disease. However, some common warning signs are shared across many cancers. These can be general, affecting the whole body, or specific to the organ involved. General signs and symptoms. These symptoms can occur with many types of cancer. 1. Unexplained weight loss. 2. Fatigue or extreme tiredness. 3. Fever or night sweats, persistent and unexplained. 4. Pain, especially if persistent and without a clear cause. 5. Skin changes, darkening, yellowing, redness, sores that don't heal. Common site-specific symptoms. Body area. Possible symptoms. Possible cancer types. Lungs, persistent cough, coughing up blood, shortness of breath. Lung cancer. Breast lump, change in shape or size, nipple discharge or inversion. Breast cancer. Colon, rectum. Blood in stool, persistent constipation or diarrhea, abdominal pain. Colorectal cancer. Prostate difficulty urinating, blood in urine, pelvic pain. Prostate cancer. Cervix, uterus. Abnormal vaginal bleeding, pelvic pain, pain during intercourse, cervical or uterine cancer. Skin-changing moles, new growths, non-healing sores. Skin cancer, melanoma or non-melanoma. Bladder blood in urine, frequent or painful urination. Bladder cancer, brain headaches, seizures, vision or speech problems. Brain tumor, caution. 7. Warning signs by the American Cancer Society, a helpful acronym. C. Change in bowel or bladder habits. A. A sore that does not heal. U. Unusual bleeding or discharge. E.T. Thickening or lump in the breast or elsewhere. I. Indigestion or difficulty swallowing. O. Obvious change in a wart or mole. N. Nagging cough or hoarseness. Important note, these symptoms can also be caused by non-cancerous conditions, but they should not be ignored, especially if persistent or worsening. Early detection greatly increases the chance of successful treatment. How can cancer be detected? Cancer can be detected in a variety of ways, depending on the type and location of the cancer. Here are the main methods. 1. Screening tests for early detection in asymptomatic people. Mammography for breast cancer. Pap smear and HPV testing for cervical cancer. Colonoscopy and stool tests for colorectal cancer. Low-dose CT scans for lung cancer, high-risk individuals. PSA blood test for prostate cancer. 2. Diagnostic tests if symptoms are present or screening suggests cancer. Imaging tests. X-rays, CT scans, MRI, PET scans, and ultrasound to visualize tumors or abnormal growths. Blood tests. Detect tumor markers, e.g. CA-125 for ovarian cancer, AFP for liver cancer. Look for abnormal levels of cells or substances. Biopsy. A sample of tissue is taken and examined under a microscope. This is the most definitive way to diagnose cancer. Endoscopy. Using a camera inserted into the body, e.g. colonoscopy, bronchoscopy, to visually inspect for tumors. 3. Genetic and molecular testing. Analyzes DNA, RNA, or proteins from a tumor to identify mutations or markers that confirm cancer and help guide treatment. 4. Physical examination. Doctors may detect lumps, skin changes, organ enlargement, or other physical signs of cancer. Early detection is critical for better outcomes, so regular checkups and screenings are important, especially for those with risk factors. Stages of cancer. Cancer is typically classified into stages to describe how far it has spread in the body. Staging helps guide treatment decisions and predict outcomes. While staging systems can vary slightly by cancer type, the most commonly used system is the TNM system, developed by the American Joint Committee on Cancer, AJCC. TNM system overview. T. Tumor. Size and extent of the primary tumor. N. Nodes. Involvement of nearby lymph nodes. M. Metastasis. Spread to distant parts of the body. Main stages of cancer, numbered stages. 1. Stage 0. Carcinoma in situ. Abnormal cells are present but have not spread to nearby tissue. Often highly curable with treatment. 2. Stage Y, localized. Cancer is small and only in one area. Has not spread to lymph nodes or other parts of the body. 3. Stage 2 and the third. Regional spread. Cancer is larger or has grown into nearby tissue. May have spread to nearby lymph nodes but not to distant sites. 4. Stage 1. Distant spread or metastatic. Cancer has spread to distant organs or parts of the body. Often harder to treat, but some can be managed for long periods. Other staging descriptions. Localized, cancer is confined to its original site. Regional, cancer has spread to nearby tissues or lymph nodes. Distant, cancer has spread to distant organs or tissues.